Hi there, Brianne here, and I wanted to talk to you today about a really common problem that a lot of women deal with. It's called stress incontinence. And basically what stress incontinence is it's when you have a little bit of leakage of urine when you are doing something usually with high impact, such as jumping or running, coughing, sneezing, that has a lot of pressure built up in the abdomen, things like that that cause women to leak just a little bit of urine. It happens with men too, but it's much more common in women. So recently, a friend of mine wrote me an email, and she said that she has stress incontinence when she jumps and runs. And she went to her doctor, and her doctor recommended surgery. And there's a surgery called a sling procedure, which is a really common surgery to help decrease the decrease stress incontinence. But I told her, she was basically asking me for a second opinion, and I told her that in my humble opinion, it's always best to try conservative treatment first. And conservative treatment means non-invasive, non-surgical. So in this case, exercise is an amazing alternative, and it's so easy to go to first rather than immediately jumping to surgery, because in many cases, stress incontinence can be treated, prevented, but also treated by way of just really a few very simple, easy exercises. So I want to go over a really simple program today that anyone can do, and it can help prevent or even treat issues with stress incontinence. So we're going to make use of a few very simple moves. We're going to use the pelvic floor muscles and actually go through a full set of Kegels. And so many people have heard of Kegels or, intend to do their Kegels every so often, but you never really do. You think, okay, I've got to do my Kegels today, and you just forget about it. But today, we're going to go through them. So we're going to go through a set of Kegels, but we're going to make them functional. It's going to be Kegels that actually do something, that prevent something. We're going to do it in a way that where you can actually use these techniques in the real world. So we're going to do that, and then a couple quick strengthening exercises to counteract that pure pelvic floor strengthening that Kegels does. We're going to strengthen the muscles that are around the pelvic floor. So again, Kegels are pelvic floor isolation exercises. So we do those, but then we also need to strengthen the hips, the glutes, the deep abdominals, and we can do that with a few very simple exercises that are quick and easy, and you can do them anytime wearing any clothes. And I thought it would be good to show you a routine in just my regular, normal clothes. I'm not in a workout outfit. You can slip this routine in anytime you can, when your child goes down for a nap, or when you're at work, or whatever. You just need a place to lie down on the ground. So hopefully you have a mat, or you can just lie on the carpet. But I am wearing jeans, a shirt. I'm not wearing anything fancy. So you can do this anytime. Slip it in and do it. If you're having problems with stress incontinence, you're going to want to do this every day until you gain quite a bit of strength in these muscles that we're working. Now, if this doesn't work for you, then I really encourage you to go see a physical therapist. A women's health physical therapist specializes in working with the pelvic floor and issues like incontinence. They also can check to make sure you're doing your Kegel exercises correctly. So I think that this is a really important thing for women to think about before just jumping to surgery. Because surgery, there's always the risk of complications, or that, it may not last forever. So this is a great first step. If it doesn't work for you, then again, see a women's health physical therapist, or see your doctor again, but this is a really good starting point. So come on and join me. We're going to do our Kegels, and the Kegels again are pelvic floor isolation exercises. So we're working those muscles that sit, this is my little pelvis. So the muscles that sit at the very bottom, where my hand is, the bottom of the pelvis. Right here is where the pelvis is, and the pelvic floor muscles are right at the base. They act like kind of a hammock for all of your pelvic organs, bladder, your uterus, all your lower GI tract. So they act like a hammock, and they also surround the urethra, the tube that comes from your bladder, and the urine exits out that tube. So they help to close off that urethra. They contract around it and help to close it off, preventing leakage. So that's why we want to do these pelvic floor isolation Kegel exercises. So join me, and I really encourage you to lie down if you're a newbie at these exercises, because it's easiest to get a good strong contraction when you're lying down rather than standing or sitting. When you're standing or sitting, you're having to fight gravity when you contract those muscles. So when you're lying down, that takes that out of the picture. So I'm going to go ahead and describe the Kegels sitting up, but I think you should lie down if you're new at this. And then I'll go ahead and go into a lying down position as well. So what you're going to do is, again, think of those pelvic floor muscles that are at the base of the pelvis. You're going to think about squeezing and lifting, so a squeeze and a lift toward your head. And then you're going to fully relax. And that is really important, that you learn how to fully let go and relax those muscles. The only way to effectively strengthen a muscle is to contract it and then totally relax it so you can contract it again. You've got to get that full movement. So again, contract, squeeze, and lift those muscles of the pelvic floor, and then let go. Watch and make sure that your gluteal muscles, your butt, isn't squeezing and making the main part of the motion. You want the main part of this tiny little motion to be the inside pelvic floor muscles, not your butt, not your stomach, your abs. You want it to be the pelvic floor. So again, squeeze and lift those muscles, hold it briefly, and then let it go. And let's just do 2 more of these really quick, simple, easy little Kegels. And again, hopefully you're lying down, because it's easiest and most effective for starting out if you're doing this lying down. Then you can transition to a more upright, kind of real world position. So let's do, did I say 2 more? Let's do 2 more. So squeeze and lift, and then fully release. And this last one, we're going to use a little visual. Pretend like you have a marble or some kind of small little ball that you're pulling into your body and then totally releasing from your body. So that is a really good visual, and we'll use it in our next Kegel exercise. So I'm going to go ahead and go down onto the ground for the next little set of Kegels. So let go, relax. I'll meet you down there. Hello. So we're down here on the ground, lying down. Again, just your knees bent. This is the position that you should be in for these Kegels if you're just starting out. So I want you to think about squeezing and lifting this time, like pulling in that marble into your body and holding it for 5 seconds. 5, 4, 3, 2, 1. And now totally release and let go. You want to kind of jiggle and wiggle out your bottom. You can rock your pelvis back and forth like this. Just release, relax, jiggle and wiggle. You can even bring your knees up to your chest. Whatever you need to do to let go. So let's do it again. Squeeze and lift. Really strongly pull those pelvic floor muscles in and up like you're pulling that marble into your body, and hold it this time for 8, 7, 6, 5, 4, 3, 2, 1, and then let it go. So working on endurance like this is really, it's important to work the quick little contractions, but also the long, slow holds. So relax, take a deep belly breath, and don't skip this, you guys. Go through this whole set of Kegels. This is important. Let's do another couple. So squeeze and lift just the inside pelvic floor muscles like you're pulling a marble into your body, and hold it for 8, 7, 6, 5, 4, 3, 2, 1. And now totally relax, release, let it go. While you're doing these, you shouldn't feel the bottom or the abdominals as the main muscles that are contracting. They might tense up just a tiny bit. That's okay. But if it's like this, if your bottom's squeezing or your stomach's drawing in really strongly, you're not doing it right. You need to think about just using those inside pelvic floor muscles. So let's do it a couple more times. This time we're going to make it functional. This is going to be something that you can apply to the real world when you have a cold, when you have allergies. You want to know how to engage those muscles and hold hold on while you cough or sneeze to prevent any bit of leakage. So squeeze and lift the pelvic floor. Hold it for 8, 7, 6, 5, 4, 3, 2, 1. And now that marble that you imagined that you were pulling in and you're holding right now, keep it inside while you do a cough, a little cough. Now don't let that marble come out. Use your muscles to keep it in. And then now you're done coughing, let it go. So that, again, that's just a real world application, and it's a way you can exercise these muscles. You can think about what happens in real life. So in real life, you cough, and if you're not squeezing those muscles appropriately, you might have an accident. So let's do it 2 more times. Just hold it for 5 seconds though for these last 2. So squeeze and lift the pelvic floor, pull that imaginary marble inside your body, and hold it for 5, 4, 3, 2, 1. Now keep it in strongly. Use your muscles with your imaginary marble in your mind. Use those muscles to keep it in as you cough. And then let it go. Relax. Let's do that again. Totally relax first. Take a deep breath. Rock it out. And pull that marble in. Hold it strongly inside for 5, 4, 3, 2, 1. Hold it in as you cough, and then let it go. So again, that was just an imaginary marble we were using, but it's really an effective way to think about keeping something in and strongly holding those muscles tight as you cough. So stretch out those legs, wiggle out the legs, bring your knees to your chest, and just kind of stretch it out. So if you have time, it is really especially important for you to add on a couple more core strengthening exercises to balance out that pelvic floor work. So let's work the inner thighs, the butt, and the deep abs. So I'm gonna move the camera just a little bit. Okay, so for this next exercise, ultimately we'll have a little ball, like a little kid's playground ball, or you can use a pillow, or you can use a yoga block. So you want to put that ball, small pillow, or yoga block between your knees. And then you're going to lie down, and we're just going to go into a bridge. So tighten your bottom and squeeze those knees together. That works the inner thighs. Gently engage your abdominals and roll up 1 vertebrae at a time from your pelvic floor on up through your abs. Hold it here and pulse it for 8, 7, 6, 5. You want to feel this deep in the glutes. And 3, 2, 1. And then roll down 1 vertebrae at a time. And keep those abs strongly drawn in. Bring your knees up. Grab onto the ball. And then just kind of flop your knees back and forth. Relax. Take a deep breath. And I'm going to take you through all of these. So really, this is a great little routine. We'll take our time with this. So squeeze that ball between your knees. And now tighten your bottom. Roll up 1 vertebrae at a time. So you're tightening your inner thighs and your glutes. And you're pulsing up. 6, 5, 4, 3, 2, 1. And roll it down. And tighten the abs, keep your back kind of close to the floor, neutral spine position. Pull your knees in, grab that ball, and then knees drop apart. So this just kind of stretches and opens the area. And let's do it again, 2 more times. So squeeze those knees together, tighten your bottom, roll up 1 vertebrae at a time, and really pulse the hips up high. 6 more, 5, 4, 3, 2, 1. Now roll it down 1 vertebrae at a time and tighten the abs. Bring the knees up. Grab that ball and relax. Again, you don't need to have special workout clothes on. This isn't really going to make you sweaty, but it's going to work those deep core muscles and all the muscles that surround the pelvic floor. So let's do 1 more rep. So squeeze the knees together, tighten the bottom, and roll it up. And pulse it 8, 7, 6, 5, 4, 3, 2, 1. And roll it down. And pull the abs in, bring the knees to your chest, and relax. All right. All right, ladies, I have one final exercise for you to add on to this program. It's really a great exercise. Again, it's a functional exercise. It's something you use in everyday life. Squatting. We're always squatting to pick things up. So I'm going to show you how to do so to protect your pelvic floor and work all those core muscles. So I'm going to come on up and I'm going to just turn to the side so you can see how far back I sit. You're going to keep your chest lifted up, drawn up, not way forward. You're going to sit way back. I want you to draw your abs in and come way down with this. If you're going far enough back and not letting your knees go beyond your toes, this is safe for your knees to go down. Now engage your abs. This is hard. Engage your abs, tighten your bottom, and breathe out on the way up. So again, sit way back, tighten your abs, keep your chest lifted, and breathe out and tighten your bottom on the way up. So again, you're sitting way back, tighten your bottom, and breathe out on the way up. Sit way back, tighten the bottom, and breathe out on the way back, on the way up. Let's do 8, 7, 6, 5, 4, 3, 2, 1. And again, this is something you think about when you're picking up your child or you're picking up a box off the ground. Think about not just sucking in your abs to protect your back, which is important, but you want to think about engaging your muscles from the bottom up, from your pelvic floor, your glutes as you stand up, and your abdominals. Zip it up, pick the item up, well, bring it close to your body, zip it up, and breathe out as you come up to stand. So that's just a really simple and important trick for you to think about during the day to help protect your pelvic floor and core muscles and your back when you're just living life. And so if you do this exercise routine, this strengthening routine, it should really help isolate the pelvic floor and those deep core muscles that surround the pelvic floor to help with your stress incontinence issues. The other thing, again, that's important about this routine and that you need to think about is remembering that pelvic brace, bracing yourself using your pelvic floor muscles before you cough or sneeze. So if you feel that cough or sneeze kind of coming on, that little tickle in your throat, your nose, you want to do your Kegel and hold it strong while you cough or sneeze, and then let it go. You can do the same thing if you know you're going to be, jumping on a trampoline with your kids for a while. Think about engaging those pelvic floor muscles. Don't just do it and let an accident happen. Think about engaging the muscles first, holding on to them as you do that activity, and then letting go. So over time, as you build strength and endurance, you should see significant improvements in the stress incontinence. And if not, go back to the doc and see what he or she can do for you. But this is a great kind of starting point to see if you can help yourself on your own. So the natural way is always the best way, in my opinion. So if you have any questions or comments, please let me know. Go to femfusionfitness.com, or you can like my Facebook page, facebook.com/femfusionfitness. I always like to hear from you, so please send me a little message, leave me a comment, and let me know what you think. I want to hear from you. So take care, and to all you ladies out there, I hope this helps.